Hi, everyone, and thank you for taking the time to join us for this really exciting webinar that we have planned for this afternoon. We're here celebrating National Athletic Training Month. We're really happy to be here in a partnership with FitDeck and the Korey Stringer Institute and talk about AED, sudden cardiac arrest, and the really important role that athletic trainers have on preventing catastrophic injury in student athletes, and specifically sudden cardiac arrest. At the FitDeck, we're a very proud sponsor of the Korey Stringer Institute, and you're going to hear a ton more about the amazing work that they're doing to try to improve accessibility to athletic trainers throughout the country. So before we start, I just want to take the time to introduce you to the presenters today. So my name is Mike Papali, and I am the Community Relations Manager here at the FitDeck, and I'm really excited to be joined by Dr. Christie Easton from the Korey Stringer Institute. She is the president of Sport Safety and the director of the Innovate program, again, which you will hear more about later. So before we start, I just want to take some time to tell you a little bit more about the work we do at the FitDeck. So we are a leader and innovator in the design and manufacture of life-saving resuscitation devices. Our medical technology devices provide easy-to-use resuscitation equipment. Public safety, healthcare providers, and bystanders depend on our products every single day. We are owned by an international medical device manufacturer, Neon Coating, and we are committed to designing and creating products that help communities around the world respond to sudden cardiac arrest. And above all, our mission at the FitDeck is to help save lives from sudden cardiac arrest. We're really passionate about our mission and making sure that AEDs are accessible so that when sudden cardiac arrest strikes, they're there to help save a life. So I'm going to take a minute and just kind of talk about our AEDs. You can probably see some of them around me here, and I want to talk about why our AEDs are ideal for athletic trainers and sports medicine professionals. So we have two of our different types of AEDs here. The first quality that I want to talk about is how lightweight they are. So obviously athletic trainers are going out to a field or going to a court or a hockey rink, and we understand that an AED is not the only piece of equipment that they're carrying out there. So when they're throwing everything into their bag, we want to make sure that our AED isn't the thing that's holding them down. So we have our Defibtech Lifeline AED, which is about 4.2 pounds, and we have our Lifeline View AED, which you can see is a little bit smaller, and it weighs less than 3 pounds. So both devices are lightweight and really easy to throw into a bag. The other thing about our kind of going off that about our AEDs is they're very portable, right? They can be taken from athletic training room to a field, to a court, to a rink very easily and quickly. So as an athletic trainer is finishing up doing their treatment for their athletes, it's very easy to take the AED, throw it on their shoulder, throw it in their bag, and bring it where it needs to go. As you can see, both AEDs have a handle. Our Lifeline has the handle right at the top here. Our View has the handle right on the side. Again, when sudden cardiac arrest strikes, it's a very time-critical emergency, and it's important that the person that's in charge, the athletic trainer, is able to grab the machine and get it to where it needs to go really quickly in an emergency situation. Next, they're very easy to use, and that's a really important feature of our products that we're very proud about. As you can see, we have two main buttons. The Lifeline actually only has two buttons. It has a green on button and a red shock button. Same thing with the View. And those are the only two buttons that are needed to be used in an emergency situation. So obviously the green on button just turns it on. And when it's turned on, it's going to talk to you and give you step-by-step instructions. And if the machine analyzes and determines that a shock is advised, the red shock button will start flashing at you and tell you to deliver a shock. Next, they're very easy to maintain. One of the things we want to make sure is that when we deploy AEDs, that's not a burden for the people, to make sure that they're always ready to save a life. So our Lifeline AED comes with a 5-year or a 7-year battery. It has both options, and our View comes with a 4-year battery. And both will let the user know that if the battery needs to be changed, it'll start beeping at you, or it'll give you a signal that it's time to do maintenance on your AED. And finally, a really simple feature again that we're really proud about is the nice bright yellow color, making the AEDs easy to find. And again, in a cardiac arrest, time is of the essence. The quicker the AED is found, the quicker it is used, the higher the chances of survival. So the bright yellow color makes it stand out amongst all the other equipment that's in the bag. So if the AED does need to be used, it can be grabbed as quickly as possible. So I'm going to take a few minutes and just share my personal story and why I'm so passionate about sudden cardiac arrest and AEDs. And as you'll see, I'm a cardiac arrest survivor. When I was growing up, I was a very healthy young guy. I was an athlete. I was a basketball player. Never had signs or symptoms that I could possibly have something wrong with my heart. When I was 17 years old, I was working at my dad's basketball camp, and I collapsed and went into sudden cardiac arrest. And as many of you know, I'm sure, since we are talking to a lot of athletic trainers and sports medicine professionals, when someone goes into sudden cardiac arrest, it's really important that CPR is provided immediately and an AED is used quickly. In my situation, CPR was not started because I was agonal gasping, and there was a mistake that was made that I was breathing and I didn't need CPR, and the CPR could actually hurt me, which was not the right decision. And the building that I was in, which was a recreation department, did not have a AED in the building. So I was very lucky that somebody in the building next door was a volunteer EMT. So when they called 911, he was sitting at his desk, his pager went off, and he recognized the address, came over and gave me CPR very well for an extended period of time until an ambulance arrived and they were able to shock my heart with a defibrillator. I was diagnosed with a disease called hypertrophic cardiomyopathy, which is much more common than people realize. It affects a lot of people. Unfortunately, which we'll talk about in a little bit, oftentimes the first symptom is cardiac arrest. And when cardiac arrest strikes, again, CPR and AED need to be used as quickly as possible. So I'm just going to talk through some sudden cardiac arrest statistics, specifically statistics that relate to student athletes. So sudden cardiac arrest is the #1 killer of student athletes. That's high school, college, professional athletes, and it happens so much more than people realize. We still associate heart disease with the older population, the population of people that might not be active or people that don't stay in shape. But sudden cardiac arrest doesn't discriminate. It affects people of all ages, all genders, all races, and unfortunately, a lot of people have a disease that they don't know about that can cause sudden cardiac arrest. It's the #1 cause of death on school campuses. So that's high school campuses and college campuses. Sudden cardiac arrest takes more lives than anything else. 1 in 300 youth have an undetected heart condition. We talk about this because it's not normal. People don't think it's normal for young people to have a heart disease, or if young people are having symptoms, they might not associate them with actually being symptoms. So it's hard to detect if a young person has heart disease or if they don't get their heart checked. So if you put 300 people in a room under the age of 18, it's likely that one of them has heart disease and could be at high risk for sudden cardiac arrest. And just for some general other sudden cardiac arrest statistics, 1 in 7.4 deaths across the United States are attributed to sudden cardiac arrest. As we know, survival rate are highest when an AED is used within 3 minutes. As we know, after 5 minutes, chances of survival drop below 50%. So the quicker we can deploy these machines, the higher the chances are of survival. And I kind of mentioned this before, but sudden cardiac arrest oftentimes is the first symptom for someone living with an undetected heart condition. So if they don't know they have heart disease, unfortunately, sudden cardiac arrest could be the thing that helps them find out, and care is critical. Just going to talk through the 6 very important links in the chain of survival. Our focus is on the first 3. When someone collapses and goes into sudden cardiac arrest, the first and most important thing to do is to activate emergency response. So here in the United States, that's by calling 911 and talking to them, listening to them, and getting EMTs on the way to help. Next is providing high quality CPR. If you're not comfortable giving breath, by just providing compressions, and just understanding that you aren't going to hurt someone by giving them chest compressions. You might crack a rib, you could break a rib, but if CPR is not provided, the person has very, very low chance of surviving. And third, defibrillation. Using an AED as quickly as possible is crucial to someone surviving. And just to touch on the last 3 links really quickly, after an AED is used, EMS arrives, the the person is in the ambulance getting further treatment from the paramedics. They're going to get to the hospital and be in the hands of a doctor. And then the sixth link was actually added within a year or so, and that's recovery, because we want sudden cardiac arrest survivors to leave the hospital and go on to live a long and normal lives. And that isn't a quick link. It's something that takes time and a lot of help from others to improve both physical and mental health following sudden cardiac arrest. So at this time, I am proud to and happy to welcome on Dr. Christie Easton from the Korey Stringer Institute, and she's going to talk about the amazing work they do and the important role of athletic trainers.
Thanks so much, Mike. I'm really happy to be here today. So my name is Christie Easton. I'm the president of sports safety at the Korey Stringer Institute. And I am an athletic trainer. And although I don't practice clinically anymore, directly providing patient care, I did work in the clinical setting for many years, working with student athletes in the collegiate and also in the high school setting. My work now is focusing really on athletic training advocacy and the importance of having access to athletic training services. But before I dive into that, I wanted to give you all a little bit of a background on the Korey Stringer Institute. So our institute was founded in 2010 in honor of Korey Stringer. And some of you may remember that Korey was a lineman for the Minnesota Vikings who passed away in 2001 from an exertional heat stroke. So this past summer was the 20-year anniversary of his passing. After his death, his wife, Kelsey, really wanted to create a living legacy to honor her husband and to also work towards preventing sudden death in sport, with a specific focus on exertional heat illness, but also the leading causes of sudden death in sport. And so to that end, she joined forces with our CEO, Doug Casa, who happens to be an exertional heat stroke survivor himself. And the Korey Stringer Institute was born. So our mission is to provide research, education, advocacy, and consultation to maximize performance, optimize safety, and prevent sudden death for the athlete, warfighter, and laborer. We serve the needs of student athletes from youth all the way up to Olympic caliber athletes. And I think that's really important because sports safety isn't just for one particular group. We offer education and research. And so I wanted to spend a little bit of time talking about the three buckets that I see as our work at the Korey Stringer Institute. So what makes us a little bit unique is that within our space in the Department of Kinesiology at the University of Connecticut, we have a heat chamber. And so in that chamber, we are conducting research. We are looking at how heat impacts the body, and providing that research helps us make policies. We also really want to look at athlete performance. So what happens to the body when you're exercising in the heat, and what can we do to help enhance performance for athletes who are performing in the heat, but not just athletes, but also warfighters and laborers. The third bucket, and this is really where my realm in the Korey Stringer Institute falls, is in advocacy. So we have the data, we have the research, but what do we do with that? You know, it doesn't do us much good if it just sits in a journal and no one reads it and no one makes any changes. So it's really important for us to interact with the public and try to enhance sports safety policies. And we have several projects that do that. Before I talk about what those projects are, I think it's really important to recognize from the research that's been done in the field that sudden cardiac arrest, as Mike has already mentioned, is the leading cause of sudden death. All sudden death that we see in sport is a result of one of four conditions: either sudden cardiac arrest, exertional heat stroke, head, neck, or spine injuries, or exertional collapse from sickle cell. We are very fortunate to have so much support from our corporate sponsors, Defibtech being one of those, and this is why we're able to do the work that we do. So I want to talk a little bit about the project that I oversee, the Innovate project. So when I was an undergraduate student at the University of Connecticut, the Korey Stringer Institute didn't even exist, which gives you a little idea of how old I am since it was established in 2010. But since then, the Korey Stringer Institute has really grown. And in 2020, I was asked to come back to the university and Korey Stringer Institute in particular to oversee the newest project, the Innovate project. And it stands for Improving Needed Nationwide Opportunities and Value of Athletic Training Employment. And so what the mission of the Innovate project is to increase access to athletic training services for underserved secondary schools across the United States. And when we say underserved, these are typically communities that are low socioeconomic status or are rural, and they haven't been able to add an athletic trainer to their staff for many reasons. The biggest barrier to hiring an athletic trainer is usually financial. So what we're able to do is provide funding, advocacy, education, and mentorship, and also strategic support to school districts across the United States to help them increase the number of student athletes that have access to an athletic trainer. And of course, it's our vision to dramatically increase the access to athletic training services. One of our projects, Atlas, tells us how many high schools in the United States currently have athletic training services. And we know that approximately 34% of all high schools in the United States have no access to athletic trainers, schools that have sports, I should say. And so Innovate is funded by a $3 million grant that was established as a result of the NFL concussion litigation. And most of that money is actually going back into the community to help schools to be able to hire athletic trainers. So when we look a little bit more closely at the NFL concussion litigation, I'm a big legal nerd and I'm always fascinated to learn more about some of these processes. But there were three primary components. So the first was that money from the litigation had to go towards retired NFL players to compensate them. The second part was to provide baseline assessment programs. But the third piece, the education fund, which is where the Innovate project receives funding, was designed to promote safety and injury prevention for football players of all ages. And here at the Korey Stringer Institute, we couldn't think of any better way to promote safety and injury prevention for student athletes than by having access to an athletic trainer. And that's really where the idea of the Innovate project came from. So what we're able to do is provide $180,000 to school communities over a 3-year period so they can hire an athletic trainer. And why is this so important? Well, as I said, I'm a huge advocate for athletic training and athletic training services, particularly for the secondary school athlete. But athletic trainers are so valuable for so many reasons. They're able to treat and diagnose chronic injuries, acute injuries, and then also be a conduit for care to follow up. They're also excellent in injury prevention and improved return to sport. They can also save your school community, your workplace, a lot of money in liability or decreased healthcare costs. And in an emergency situation, as Mike previously said, it's so important, especially when we're talking about cardiac arrest, that you have someone on site who's able to recognize this emergency has happened and know how to provide the appropriate care. I think one thing that I really want to emphasize is that athletic trainers are important for athletes at all levels. And we know that athletic trainers work in settings beyond traditional athletics, but the Innovate project is focusing specifically on the student athlete in the secondary school. And this is so important because these particular athletes have emotional and physical development still ongoing. And most of these student athletes in the communities that we work with Innovate don't have any access to healthcare beyond what they have in their school system. So we're very excited to be able to help provide athletic training resources. The one thing that I did want to share as well, and Mike touched on some really great statistics. We know from work that's been done by our colleagues in the field that 1 in 70 schools will experience a sudden cardiac arrest on their campus every single year. And of those, over half of them are occurring in athletes. What we also know is that the chance of survival from a sudden cardiac arrest is almost 90% if one of 3 things are in place. The first is that it was witnessed. So someone actually has to see the collapse. And having an athletic trainer on site is so important because they can recognize that, or they're a resource if someone else recognizes that. The second thing is that there was an emergency action plan. And again, the athletic trainer is the perfect person to have at a school to help develop emergency action plans specific for sport. And the third thing is that there was an AED and it was applied within 3 minutes. So if you have those 3 things in place, the chances of survival from a sudden cardiac arrest is over 90%. And just to reiterate some of the things that Mike was talking about, we know that survival rates will decline 7 to 10% per minute for every minute that an AED is delayed. So again, having someone on site to provide prompt care and recognition is very important. So we can't emphasize the importance of that enough.
Yeah, so thank you so much, Christie. It's unbelievable information, and I've gotten to know the Korey Stringer Institute really well over the last year and a half, and every time I hear someone like yourself talk about the work that you do, I'm always blown away. And that was just a small piece of it. There's other programs like Tufts and Atlas that you touched on that you all are doing amazing work and really making a difference in helping save lives of people of all ages. And of course, cardiac arrest being one thing, and all the other work that you're doing as well. So I should have mentioned this before to everybody. If you have a question, you can hit the Q&A and you can enter it in there. And then we're going to kind of go through some questions that have been asked already. So you have a few minutes if you want to enter some questions into the Q&A. Chrissy, what I'll do is I will read the question and I'll let you know kind of if it's one for you to answer, if it's one for me to answer. So I think the first one here is actually one for us at FitDeck, and actually you probably have some insight on this as well. But the question is, what is the ideal number of AEDs our school should have? And I'll start, and feel free to interrupt me if I'm missing anything. But our suggestion whenever someone asks, how many AEDs should we have, is ideally an AED is accessible within 3 minutes of all locations. So that means, to clarify, that means by the time the AED is retrieved and you turned on, pads are on, it's 3 minutes or less. So that means in theory, 90 seconds to go get the AED, 90 seconds back maximum. So when people say, okay, how many AEDs should my school have? Well, that's the kind of the marker you should use. If you have a big school that's 4 floors, you should at least have an AED on every floor. We put a big focus on making sure that athletic trainers have an AED that's accessible for themselves only. So meaning that they don't have to go in to the main office and take the AED off the wall to bring out the practice. They have one that's designated for the athletic trainer. So when asked, how many AEDs should our school have, we always try to use that marker of, as long as there's an AED within accessible within 3 minutes, we think that's a really, really good place to be.
Yeah, and Mike, I would echo that. So when we talk about policy adoption, we want to have an AED accessible within 1 to 3 minutes of any location. And I would add, although this wasn't the question, that it's really important that those AEDs are accessible as well. So oftentimes when we're talking about athletics, there might be an AED in the gym, but you're out at football practice and now the building is locked. And so how do we get inside and how do we get that? So it's also making sure that the AEDs that you have are also accessible. And the second piece of that is, if you have an AED, if you have more than one AED, people need to know where that AED is, so that if an emergency happens, I am going to the very closest AED. Unfortunately, we have countless stories where there's been a sudden cardiac arrest, and either they couldn't get to the AED, or they didn't know that there was an AED literally in the shed right next to them on the field. So the number of AEDs is really important, but it's also important that the AED is accessible and everyone knows where those AEDs are.
Definitely, that's great points. We have seen that in different settings, that people that might not work with the AED every single day don't necessarily have the awareness of where it is. And when we talk about an emergency and somebody's telling you to go get the AED, you want to be empowered to know where that closest AED is and get it as quickly as possible. So next question, Christie, I think would be more for you. So it looks like an athletic trainer is asking, how can they help the Korey Stringer Institute in your mission and the work that you do, in any way, by providing information, or really any way that an athletic trainer can help you all at the Korey Stringer Institute?
That's a great question. I love that one. So there's lots of things. So the first is that change really usually happens at a grassroots level. And don't ever forget that as an athletic trainer, you have a really powerful voice within your community. You are, in the majority of situations, the person who is most educated and best trained to handle these kinds of situations. So don't forget that when you're talking to coaches or administrators and they're telling you no, keep pushing back, because when you do that, you're going to slowly make a change. The other thing that I'll say that's really important as an athletic trainer is that you never know who you might be interacting with. So if a student athlete gets hurt, their parent might be a doctor and now they're a big advocate for you, or they might be a legislator and now that person remembers that there is an athletic trainer that made a difference in their child's life. Or maybe the student athlete then makes a decision to go on to be an athletic trainer. So don't ever forget what a powerful voice that you have within your own community. Making changes, small changes within your own community, your own organization, can be very powerful. And then that helps us when we come into a state and we try to make changes and we try to create policies that says there has to be an AED within 1 to 3 minutes of every venue. Because if schools and communities have already started to do that, it makes making policy changes that much easier. So your voice is extremely impactful. With that being said, please know that we are always happy to provide data to you. So if you really are pushing and you want to try to encourage your administrator to add an AED to your school, not only will we connect you to Defibtech, but we'll also provide you with the data that can help support your push to move things forward. So you have a really strong and powerful voice.
Yeah, that's awesome. Okay, next one. So someone asked, and you kind of mentioned a little bit about this, but how can I find out about acquiring the FitDeck AEDs for our school? And easiest thing to do is just visit or send an email, I should say, an email to info@defibtech.com. Visiting our website, www.defibtech.com, is a great way to learn more about the AEDs and all the different products that we have. And once you reach out, someone will contact you very quickly to get you in touch with the right person and make sure that we're again fulfilling our mission, which is to help save lives by deploying AEDs. I have one more question, so I'm going to do a last call. If anybody has more questions, please add them in the Q&A now. And the last one, Christie, for you is, do you have resources on your website for creating a good emergency action plan for us to use at our school?
Yeah, we do. Great question. So on the Korey Stringer Institute website, we have templates, and it's literally, we highlight the area that you need to fill in. So this is a really good reminder for me to highlight some of the things that's really important to have in your emergency action plan. So remember, emergency action plans should be venue specific. So you should have an emergency action plan for your basketball court and your baseball field and even your athletic training room. Those emergency action plan should also list the emergency equipment that you have available and where that emergency equipment is located. It should also include the number for 911 and the address of the number for 911, the number for EMS in case it's not 911. You also want to make sure that you include the address of the location so you can help direct first responders and paramedics to the scene. So yes, we do have templates for emergency action plans on our website. One more thing that I think is really important, and I'll take any opportunity I can to talk about this. Please remember that emergency action plan is designed to be the steps that you follow in the event of any emergency. So whether it's a cardiac arrest, it's an exertional heat stroke, it's a traumatic spine injury, these are the steps that I am going to take in an emergency. This is who's calling first responders. This is who's opening the gate. This is who's directing the ambulance in. It's your policies and procedures that then get specific to the individual condition. So what am I going to do in the case of a cardiac arrest? And that's a really important differentiation. Emergency action plans shouldn't be 20 pages long. If we can keep them to a page, that's ideal. And the reason that that is so important, and this goes back to some of the things that Mike had talked about and we talked about, is that an emergency action plan is only as good as its ability to be followed. So you need to share that with your coaches and your administrators and anyone else who will be involved, so that if something happens, now the coach knows that there's an AED in the shed right over there, and I'm going to go get it and I'm going to bring it back. One of my favorite examples of this, and I hope you don't mind, Mike, if I tell a little story here.
No, please do. Please do.
When we were in Maryland, we had the opportunity to talk to an athletic trainer who had to use an AED on a lacrosse player. The athlete suffered a commotio cordis, and they were very lucky. There was 2 athletic trainers on site at the game that day. There was an athletic trainer who had an AED right next to them. They ran out onto the field. Within a minute, the AED pads were applied. While they were working on the student athlete, a coach from another field, because he heard the call go off on the radio, he ran over with his AED because he knew that when an emergency happened, he had to be in charge of grabbing the AED. And so when you have a witness collapse, you have an emergency action plan in place, and you have an AED, your chances of survival are 90%. And in this situation, the student athlete survived. And so I think the emergency action plan is a really big, important component. So that was my long way of saying, yes, we do have templates and we're happy to share them.
That's awesome. Thanks for sharing. That's an incredible story. So again, thank you, Christie, for taking the time to be here with us today and tell us more about the Korey Stringer Institute and the work that you all are doing. Here's some contact information for everybody for both FitDeck. Again, I said this email before, but info@defibtech.com. If you need to call us, someone will answer your call and get you directed to the right person. And if you want to learn more about the Korey Stringer Institute, www.ksi.uconn.edu. I would strongly suggest you take some time on that website, because there's a ton of valuable resources for athletic trainers and all people that can help in all different types of catastrophic injuries for student athletes. So we thank you for taking the time to be here with us today. We are excited to continue to bring more webinars. So follow us on social media, check out our website, check out our emails, and we'll definitely have more webinars coming for you soon. Thank you.
Mike, can I add one more thing before we finish?
Yeah.
Thank you so much for letting us be here and to talk about Innovate. On our KSI website that Mike just mentioned, we have a tab that says Outreach, and it'll take you directly to Innovate. So if you're interested in the Innovate project, you can reach out to us there, and we will be funding one more cohort if you're interested. So thanks so much for letting me talk about that today.
Awesome. Yeah, thank you. Take care, everybody. Thank you.